The Varian Edge machine that Medanta has established and made clinical in the last month has an advantage over the existing linear accelerators and the radiation facilities at Medanta by way of providing a HyperArc, RapidArc Dynamic and image guidance with surface guided radiation therapy as well as respiratory gated radiation system, which is a first of its kind in the country at present. For surface mapping, there is an identify system which gives us the surface guided radiation capability on the H machine. There is a respiratory gating system which the patient does not have to hold anything or hold the breath, and the system can track the chest movements of the patients as the breath goes in and goes out. HyperArc is very beneficial for the patients with multiple brain metastases because the patient does not have to move while on the table. The table is automatically moved from outside by a computer control as the machine is moving around the patient in different coplanar geometries. Similarly, for the respiratory gated system, the patient normally breathes and the cameras in the room will track the chest movement of the patient, thereby guiding the radiation directly into the targets, namely into the lung cancers. In addition, for breast cancer patients, for abdominal cancer patients, the identifier system maps the surface of the skin by an infrared camera and feeds back it into the system to track the normal movements of a patient's body geometry and target the radiation. Plus, the overall treatment delivery time is reduced to about a minute. So, the total time spent in setup and on the couch for a patient is much shorter as compared to the previously existing equipments. So Medanta has already been using stereotactic body radiotherapy as well as stereotactic radiosurgery platforms since its inception in 2010, whereby we were using Synergy S platform with a beam modulator, and subsequently since 2012 we went clinical with a CyberKnife VSI system that allowed us to treat almost all body parts of with stereotactic radiosurgery and stereotactic body radiotherapy also, and we have almost more than 3,000 patients that were treated over the last decade. Looking at the experience that Medanta has already gained and successfully treated these very complex cases, a Varian Edge machine scores over the existing equipments by way of delivering the HyperArc treatment for multiple brain metastases in a short span of within 10 to 15 minutes, which normally on a CyberKnife would take approximately half an hour to 40 minutes for us.